of roots. Crown of the tooth, that is corona dentis. It has in incisors, it has a flat upper sharp border. In canine dens, it has conical shape, not so clear to see here. It should be conical shape in canine dens. In premolars, it has two tubercles, anterior and posterior. And in molars, it has four tubercles, 1, 2, 3, 4. And number of roots in scissors, in canine dens, and in premolars we have one root. Sometime premolars subdivides root of premolars of upper second molar subdivides into two. And molars usually have two roots, sometimes maybe three roots, like here. Here it is even four. 1, 2, 3, and 4. It's not so frequently, usually 2 or 3. But here it is, we can see 4 roots in molars. Each tooth has crown of the tooth has external coat, that is enamelum. External coat of the root of the tooth, it has cementum, and most part of the tooth, main structure of the tooth, that is dentinum. Inside of tooth we have cavitas dentis, and inside of the root we can see canal, canalis, radicis, dentis. And these canals, the same like cavitas of the tooth, has pulp, pulpa dentis. This pulp consists of blood vessels, nerves, and connective tissue. You should know what is tooth as an organ. Tooth as an organ consists of tooth, then consists of alveolar dentalis, that is in mandible or in maxilla, alveolar dentalis. Who remember what is the name of connective tissue which is fixed tooth in alveolar dentalis?
Dentist.
Oh, that is type of articulation gymphosis, but name of this connective tissue is periodontium, that is connective tissue. And vessels and nerves which supplies tooth, all of these structures together, and gum the same, gingiva, gum. All of these structures which is surround tooth and tooth together forms tooth as an organ. Tooth as an organ. What else? You need to know time of eruption of tooth. For example, first milk tooth appear in which age? 6 months. The same we can remember formula of the milk dance. For milk dance, n minus 4. And that is number of months. For example, at 4 months, 4 minus 4, 0. At 5 or 6 months, 5 minus 4, that is 1. 6 minus 4, 2. Two lower incisors usually start to grow together. That is why at the age of 5 or 6 months, two incisors start to appear. And in 1 year, that is 12 minus 4, how many teeth we can see? 8 teeth. 8 teeth we can see in 1 year. And the time where milk dens start to change into permanent dens, that is 6 years. At the age of 6 years, milk dens start to change into permanent dens, and last third molar appear after 16, usually after 18, sometime at 12, at 20 years, so maybe last third molar may be absent. That is dense, dense serratinus, name of last third molar. Well, some words about oral cavity. Oral cavity, cavitas oris, subdivides into two parts. First, that is space between lips and cheeks, in front and laterally, and teeth with gingiva, that is vestibulum oris, vestibulum oris, and cavitas oris propria, proper cavitas of the mouth, that is space which is behind of teeth, and cavitas oris propria, it has opening of parotid duct. Ductus parotidus, it is absent. In front of external acoustic meatus, we have parotid gland. Only small part of parotid gland, it is, we can see that is small part of parotid gland. And duct of this gland, ductus parotidus, it passes on the external surface of masseter muscle, then it's perforate buccinator muscle and opens into the vestibule opposite to the second upper molar, that is a place on the cheek where ductus parotidus opens into the vestibule opposite to the second upper molar. Cavitas oris propria, superior wall of this cavitas, that is hard and soft palate. Hard palate consists of which bones, who remember? Palatine process of maxilla and lamina horizontalis. Palatine bone, good. Flow of cavitas oris propria forms with the help of muscle, who remember? Which is what is the name of muscle which participate in diaphragm of the mouth. Mylohyoid muscle, musculus mylohyoidus, good. Anteriorly, we already said that is teeth with gingiva, and posteriorly that is opening between oral cavity and pharynx, that is fauces. Superior body of fauces, that is soft palate, that is velum palatinum, posterior body of soft palate, velum palatinum. Laterally, we have folds between soft palate and tongue, that is arcus palataglossus, it is, and inferiorly dorsal surface of the tongue, dorsum linguae, or root of the tongue, radix linguae, that is inferior body of fauces. One again, superiorly velum palatinum, laterally plica palataglossus, or arcus, arcus palataglossus, and inferiorly root of the tongue, or dorsal surface of the tongue, that is walls of fauces. Cavitas of the mouth, inside of this cavitas we can see tongue, and tongue, that is muscular organ which consists of muscles. Of course, necessary you need to know names of these muscles. For example, all muscles of the tongue subdivides into three groups. First group, they are muscles which start from the mandible, mandible, that is musculus genioglossus. It starts from inner surface of mandible and goes to tongue. And continuation of this muscle, that is musculus verticalis. You can see vertical fibers which pass through tongue. That is musculus verticalis. It is continuation of genioglossus muscle. Second group of muscles, they are muscles which start from body and of hide bone, from hide bone. They are musculus longitudinalis superior, musculus longitudinalis inferior, and hyoglossus muscles the same, musculus hyoglossus. And third group of muscles, they are muscles which start from styloid process and from greater horns of hide bone. They are musculus styloglossus, musculus palataglossus, and continuation of musculus palataglossus, that is musculus transversus linguae. On mucous membrane of tongue has a lot of papilla. Some of them are receptors of general sensivity. What is it? General sensivity. That is temperature, feeling of temperature, feeling of pain, tactile sensivity. And they are smallest papilla of the tongue. They has name papilla filiformis or papilla conica. They has conical shape. Larger papilla, they are papilla of taste sensitivity, and they are papilla fungiformis, papilla foliata. Foliate papilla we can see here. They present on lateral side of the tongue and looks like pages of book. You can see here it is papilla foliata. And last papilla, and they are largest papilla of the tongue, they are papilla vallata. Here it is, for example. They looks like number 5, Roman number 5, or letter V. That is V-shape location of papilla vallata, and number of this papilla is from 5 to 10 papilla, and they present on the body between posterior third of the tongue and upper two thirds. That is the body where papilla vallata are present. We have not got another tongue. Maybe next time you receive preparate where tongue is separates from the head. Maybe there we can see more better papilla of the tongue. What else? One fold is arcus palataglossus, another fold is arcus palatapharyngeus. And in space between these two folds, we can see fossa, that is fossa tonsillaris. This fossa is fossa tonsillaris, and which tonsil is here? Who knows? Palatine tonsil, you're right, palatine tonsil, that is lymphoid tissue, which is occupies space between these two folds, that is palatine tonsil. Posterior third of the tongue, the same has lymphoid tissue,